Hi, this is Dr. Becky Kuhn. I'm a physician who specializes in HIV/AIDS. Welcome to I'm Over 50. Do I have to worry about HIV? This video will explain why older individuals need to be just as careful to avoid contracting HIV as younger people do. Is HIV just a problem for young people? People often assume that older adults don't need to worry about HIV. Many people associate HIV and AIDS primarily with younger, sexually active individuals and incorrectly stereotype them into various categories. Few people realize that in 2005, 15% of new HIV/AIDS diagnoses in America were in people aged 50 and older. That means that almost 1 in 6 new HIV/AIDS diagnoses are in people aged 50 and older. Moreover, because people with HIV/AIDS are now living longer, in 2005, 24% of people living with HIV/AIDS in America were age 50 and older. Older people have similar risk factors to younger people. Although people in the developed world often perceive HIV as a disease of young people, particularly gay men, minority communities, and injection drug users, the reality is that older people have many of the same risk factors as younger people. The Centers for Disease Control and Prevention notes that like younger people, older persons exhibit the same behaviors like having sex and injecting drugs, which can put them at risk for HIV infection. According to their website, quote, HIV transmission through injection drug use accounts for more than 16% of AIDS cases among persons age 50 and older. Additional risks faced by older people. Since postmenopausal women no longer need to worry about preventing unwanted pregnancies, they do not use contraception and may choose not to use condoms as a result. It is important to remember that older women are also at risk for contracting sexually transmitted diseases, including HIV. In reality, they need to use condoms, even if they are no longer able to become pregnant. As women age, the vaginal wall grows thinner and vaginal lubrication is reduced. This can lead to tears in the vagina that increase the risk of contracting HIV. Many older people may be less knowledgeable about HIV and wrongly perceive themselves as not at risk. This may increase the risk that they will fail to use condoms during sex and not get tested for HIV. Studies have shown that if people have multiple sexual partners, the risk of HIV transmission is increased. A person is most infectious and most likely to transmit HIV in the period immediately after they are initially infected. The development of medications for erectile dysfunction, such as Viagra, has meant that many older men who were previously unable to have sex are now sexually active again. At the same time, because men die younger on average than women, there is a gender imbalance among people in their 60s, 70s, and 80s. This means that the relatively smaller number of sexually active older men have the opportunity to have multiple sexual partners. The combination of a smaller number of older men who are once again capable of sex and the ability to have unprotected sex with a potentially large number of older women who may be longing for companionship increase the possibility of transmission of HIV. Risk that health professionals will fail to diagnose HIV/AIDS in older people. Older people may be less likely to receive education on HIV prevention and testing. The Centers for Disease Control and Prevention note that, quote, healthcare professionals may underestimate their older patients' risk for HIV/AIDS and thus may dismiss or thus may miss opportunities to deliver prevention messages, offer HIV testing, or make an early diagnosis that could help their patients get early care, end quote. The CDC adds that, quote, physicians may miss a diagnosis of AIDS because some symptoms can mimic those of normal aging, for example, fatigue, weight loss, and mental confusion, end quote. Older individuals can assist the healthcare professional and help prevent these kinds of oversights by getting regular medical checkups, informing their doctors of any risk factors they may have for HIV, and asking to be tested for HIV. HIV stigma among older people. The Centers for Disease Control and Prevention note that, quote, the stigma of HIV/AIDS may be more severe among older persons, leading them to hide their diagnosis from family and friends. Failure to disclose HIV infection may limit or preclude potential emotional and practical support, end quote. Inadequate emotional support may increase their risk for clinical depression as they confront the challenges of HIV and AIDS. It may also make it harder for older people to reach out to friends and family to seek help for practical needs like transportation to doctor's appointments, supplemental care, and other needs. No matter who you are, you're a valuable individual. If you are a person over 50, realize that you need to be just as careful about HIV as younger people. If you choose to be sexually active, get tested for HIV to know your status and insist that your partners do the same. Use safer sex techniques like condoms to reduce your risk of contracting HIV and other sexually transmitted diseases. This is Dr. Becky Kuhn.